when we learned that there's actually an association between having the flu and increased risk of heart disease. In fact, a 2008 study showed that there's a six-fold increased risk of heart attack in the week after flu infection. And if you look at all the patients hospitalized with flu infection, a large study of 80,000 patients showed that 1 in 12 people hospitalized with flu infection will have some sort of serious sudden complication associated with heart disease. So the link between flu and heart disease really came to light relatively recently. And what we're learning about the mechanism is that it appears to be mediated largely by inflammation caused by the flu and the aftermath of that inflammation then triggering heart attacks. What's interesting here is, of course, it's the older people, as we would expect, but it's actually those people who don't have a history of heart disease that seem to have some of the most pronounced effects of having potential cardiac inflammation or heart attacks triggered by the flu infection. Study has shown that those who get the flu shot have a 10% lower risk of having cardiac complications after being hospitalized with the flu. So, not only does the flu vaccine boost your immune system, which we've talked about, help you fight the flu, it helps you fight other types of respiratory infections as well because it leads to that revving up of the immune system. And now we're learning that it also helps you fight heart disease or heart attack. So there's so many great reasons to get the flu vaccine, which we know is safe and it's efficacious and it's well tolerated. So anyone over the age of 6 months absolutely needs to get the flu vaccine, and especially those people who are older or who may have had a history of heart disease, they need to definitely get the flu vaccine this year. People often wonder about what is the best time to get the flu vaccine, and there really is a sweet spot for when you should get it, and the ideal time is right now. So the month of October is the best time to get it, but definitely no later than October 31st, because if you do that, you're going to be unprotected for a large part of the flu season, which we know is going to peak in December or January.